To provincial politics now, and hallway medicine is one of the biggest challenges this government here at Queen's Park faces, and Doug Ford has promised to end it. And one of the contributing factors to hallway medicine and overcrowded hospitals is the lack of long-term care beds. Well, today in the legislature, the leader of the opposition asked the government just how many long-term care beds they've created in the last year. They didn't have the answer, but she did.
The answer is 21, Speaker.
Order.
21. Between July 2018 and August 2019, the government only created 21 beds. And during that same time, while they created 21 beds, Speaker, the wait list grew by more than 2,800 people.
There are currently 36,000 people on the wait list for long-term care, and it's causing a ripple effect in the healthcare system. The health minister has confirmed roughly 25% of patients in hospitals should actually be in long-term care, but there are no beds for them. Not only does it contribute to hallway medicine because patients have nowhere to go, it's wasting taxpayer dollars. An acute care bed in a hospital costs $1,400 a day. A long-term care bed, about $177 a day. In a previous story, CityNews crunched the numbers and found the lack of long-term care beds was costing taxpayers roughly $460 million a year in wasted hospital bed time.
Minister of Long-Term Care.
Thank you, Speaker.
The Ford government is promising to create 15,000 new long-term care beds in 5 years. Yesterday, the Financial Accountability Office, the province's fiscal watchdog, said hallway medicine will only get worse because the additional beds still won't keep up with demand.
How are you going to do it faster? You need thousands a year, not 21 a year.
And that's a really important question, and that's why we've taken the time to consult with our sector to understand what the challenges are. It takes about 36 months to build a long-term care bed, but the reality is there are processes that can be streamlined, whether it's addressing zoning issues or looking at how we address land issues or staffing issues.
The minister couldn't answer how many new beds will be added to the system in the coming year, but did point the finger at the previous Liberal government.
If we look back to 2011 to 2018, it's really striking. Only 611 beds during that time under the previous government, which is actually shocking while we had that time to build capacity.
I mean, did your government fail?
No, I don't think that. No, I don't think I wouldn't accept. I wouldn't accept the premise that we failed. Could we have done better? Yes.
It's been growing for years, and the Minister of Long-Term Care pointed out that simply building long-term care homes isn't the only solution because people actually really just want to stay in their homes for longer. So the government is looking at innovative new ways to keep them at home, for example, virtual care or community programs with paramedics.